It's July 24th, about 9:30, and I wanted to hop back on here before the kids woke up this morning and trying to touch on some things that I didn't mention in the first C-section video, and say that I'm going to go ahead and tell the individual cesarean stories. The first set of kids were pretty much the same, so I'm just going to lump those in with the last ones. It was the last three that were significantly different from what I noticed. Let's see, what did I want to say? Factors. I mentioned, making sure your health is top. If you are needing to lose some weight, do that. Make sure you eat right. Make sure you exercise, because those are factors that are important. That's important in pregnancy period. You want to make sure you are in the best of health that you can be, so that you don't have other issues. What I wanted to bring up is the risk. Again, yeah, there are risks, there are complications, but a major issue in determining if you're a candidate for repeat C-section, meaning you don't have to, it's not medically necessary to tie your tubes, because there are women that have gone on to have maybe a second one and it's medically necessary. If you've had an emergency cesarean, meaning you have to they have to get the baby out like right there. I've had emergency where it's been, okay, we have to go in today, but it wasn't, we have to go right now. But if they have to go like right then and they have to get in there within a minute or two, they're going to give you a vertical incision. And some people say they're easier to recover from, but if you get a vertical incision, there are two cuts. They're going to do one outside and one inside. If both of those cuts are vertical, most likely you will not be able to have another one. They will tell you it's medically necessary to have a tubal, because the risk of your uterus or uterine rupture, either during recovery or, at some point, if you were to get pregnant again, that scar tissue grows up around it, it may rupture. It's also greater risk for placenta previa, where the uterine scar tissue, like I said, just grows around that that incision. Things like that can, let's see, the baby's umbilical cord can get fused into that scar tissue. That's the reason why I said ask questions, find out how much scar tissue you have, see if the doctor will take out as much as they can so that you don't have all that scar tissue. Like I said, after the 13-year-old, well, he's 13 now, but after him, the doctor did remove a lot, and then when I had the twins, he took out the rest of it, and I was pretty much clean. And so I didn't have anything to worry about, because that had been an 8.5 year gap between surgery, so plenty of time to heal up, and everything was back together. Let's see what else. Previa abruption, I think it is. And that will cause a hemorrhage. You could hemorrhage, and that's another risk factor. So those incisions, both of mine are horizontal incisions. Each time they've all been horizontal. So that's the reason why I haven't had to medically come to that medically necessary point. So unless I get to a point where the doctor says, okay, this is medically necessary, you are, and I see, I'm bleeding, I'm having a transfusion, things like that, or my blood pressure it's already been stroke level. But if I'm just all out done, I know I'm done, I know my body can't take anymore, then I'm going to say enough. I don't know at this point if I will have any more kids. Kind of premenopausal or menopausal. My mother went through menopause pretty early. She was around 33-ish. And I'm a lot older than 33-ish. So, yeah. Things like that tend to be genetically predisposed. And so I noticed the symptoms because I remember her and what she went through. So I pretty much know, but there's always that chance. What else? So yeah, your incision, you have to stay on top of it. You can request your medical records. I think sometimes they're probably $10-$20. It just depends. You have to go through your hospital I want to say the registrar, and it usually takes a couple of weeks, and you'll go and pick up your records, and you can read your records. I mean, it's yours. You can have them for yourself and kind of read it. That way you'll know exactly, especially if you're a traveler, you all move a lot, and you really want to make sure that doctor is really reading the notes, not just going by what you're telling him, because you really don't know. And even if they were to get the records, sometimes they're not complete. It's just whatever was last on file. But to get the whole history, you would go through your hospital. So let's see, what else? Oh, bleeding, that postpartum bleeding. I didn't bring up, I mentioned it in the comments. When you have a cesarean, 95% of the blood is suctioned out. So, the great part is you don't bleed nearly as much. Probably the first day is the worst. And even then, it's still not that bad. You're going to pass some clots, and that'll be it. Once you get up the first time, the next day, the majority of it will begin to flush out. You're only going to bleed about a week, really. Some people may still have a light bleed, maybe beyond that, but once you start moving around, that blood loss is just wiped away significantly. I've had extended stays in the hospital for 8 and 9 days. Usually by the time I go home, there's nothing. I'm not bleeding anymore. And I noticed that the more cesareans I had, the less bleeding I had. I think one of them, it was only, let's see, I was 2 days maybe. It stopped that second day. So, which is great, because dealing with the baby, and if you're nursing, and then you're tired, and then you're bleeding, you're recovering, and that's a lot of stuff. But yeah, the incision itself is not hard to take care of. They will give you all of your wound care and everything in the hospital. They will encourage you when you take a shower to make sure you pat and clean that area, you have to lift that extra skin. Like I said, that extra skin is not going anywhere. If you didn't see the last video, look at the last one, and you saw the top portion of my stomach. That is my stomach, my core. It is tight. All of the scar tissue was removed, and what happened was the excess skin fell to the bottom. I've seen a lot of women with all of that excess skin, even in a vaginal delivery, still at the top, and they're having problems getting rid of it. But yeah, that excess will drop, and you wear your binder and it's gone. So you want to make sure you lift up under there, and they will tell you also to use a sanitary pad and press against it. That way it can stay dry. And sometimes they will, you know, they'll just do it for you. Once you get into recovery, they'll come in and put it in, and you pull your panty up over it. So yes, it is better to use the netted hospital panty during a cesarean, because you want that airflow. You don't want to sweat down there, because it will start to get ill, and that can lead to an infection, and you don't want that. So I don't know, some people say it's uncomfortable, but they're not that bad. Let's see. What is another tip? Use your peri bottle when you take a shower. They're going to give you a peri bottle. Use a peri bottle to reach under that pouch, so that you can squirt that water and clean it. And you should be fine. You know, and the other tip, as it heals, probably in a week or so, once you get home, take a blow dryer, a hair dryer, and dry it, and just, you know, it'll kind of soothe that itch. Oh, speaking of itch, when you get anesthesia, sometimes you itch. Ask for Benadryl. A lot of times in recovery, when they're giving you, say, I can't think of the name of it right away, but it's an antibiotic, you will itch. Ask for Benadryl, and just usually within 24 hours, you know, a 24-hour dose. Sometimes even one dose will stop that itch. But you will notice your nose will itch, and it'll just get on your nerves. So ask for some Benadryl. Let's see, what else can I bring up? And again, I cannot stress on the medication. Stay on top of your medication. Nurses get very busy, and you are not their only patient. There are lots of issues that go on. I remember, I think with the last baby, I was almost due. I would always make sure an hour before, because usually somebody's coming in to take your vitals anyway. Hey, you know, go get my meds ready, and you know, send the nurse in here. That way they can be ready, you know. Because if you don't say anything, you're just sitting there relaxing, or you have a lot of family, you tend to kind of forget, and then you start feeling bad, and it takes a little bit longer for that medication to kick in. There was a lady that had delivered vaginally, and apparently she was hemorrhaging severely, and they needed everybody, and I was like, oh my gosh, I need my medication. And so, yeah. You don't want a gap. Even if you feel fine, even if you're sleepy, take it before you fall asleep. Just take it. You may get to some point and you say, okay, I don't need, you know, they'll say, do you want your medication? No, I don't need it. But then a half hour later, you know, you're starting to hurt. And it's not a bad hurt. Just, you know, it should be a dull pain. Ask for it. You know, they'll get you up and let you walk around. They'll take your catheter out. You get a catheter before you prep for your anesthesia. They're going to put the catheter in. So they'll take that out the next day, and they'll get you up so that you can walk. Stand upright as much as you can. Don't bend over. Take small steps and go to the bathroom. Oh, and another thing about go to the bathroom. ask for a stool softener. A lot of times they will not let you go home until you have a bowel movement after you have a cesarean. And because you haven't eaten, it's really hard to produce, especially because you're nursing. All of that energy and food are going to your milk. Ask for a stool softener. And I usually say the next day, because you start to feel, they'll ask you if you're passing gas. You may feel a lot of gas because you've been open. So you're going to have a lot of gas, but you can't get it out, and you feel it, and you need to get it out. If the stool softener does not work within, that's why I say the next day, overnight, ask for a suppository. That way you can go, because once you go, you will feel so much better. Yeah, TMI, but hey, if you've never had one, just something you should know. Yeah, you will feel a lot better, and especially that pressure, it'll go away from your incision, because that's part of it. You really need to just go to the bathroom, and then you're going to be eating too. Usually the next day you're able to eat again. So you want to get some get some stuff going in you. Make sure you keep those fluids up so that you can, I keep hearing the noise, become productive again in that area. Okay. I'm looking out the window. Sorry for this. Just trying to recall what all would be very significant. If your pain medication, not all pain medication works the same. Do not be afraid to say, even after, give yourself 45 minutes. I'm still hurting. Okay, sometimes you have to really stress it, because they will say, well, I just gave you such and such. But you will know after 2-3 doses of your pain meds how it works on you, how it really affects you, how long it takes to kick in. So if it does not work, I'm hearing people outside. If it does not work, ask for something else, and try to remember what it is that they're giving you. Okay? That way you can say, this is what works. They're going to send you home on Tylenol with codeine. And I know a lot of women will say, oh, I don't want to take this because I'm nursing the baby. I'm da-da-da-da-da. You need medication. You just had major surgery, okay? If you are in pain, that will elevate your blood pressure. You will be miserable. That will affect that baby, because the baby can feel if you are in pain and distressed. You won't be able to nurse your baby. Do not worry. That medication is not going to pass on to that baby. Okay? You need it. You may become weepy, and not to say that you're depressed, but the more cesareans women tend to have, and that's why I say you have to be mentally prepared for this, you're likely to experience some sort of depression at some point. It could be, a couple of weeks, it could be a couple of months, it could be 6 months, where you have days where you just feel like you can't cope. And it's common the more kids you have. That's why I ask people, they say, how do you manage? Okay, my kids pretty much can take care of themselves. We, don't do anything. And that's another thing. Come home and stay home. Don't try to get up and move around like you were. You have a baby. If you're trying to pick up and do life like you used to, you can't do it. And it will stress you the hell out. Seriously. Come home and relax. But I see a lot of women try to come and I need to do this and I do this and I have to do this and I have to go back to work. And okay, yeah, but you need to take that time for yourself and just chill. So postpartum depression, postpartum psychosis is when you guys hear stories of women harming their babies, drowning their babies, things like that. That's psychosis, and that is real. It is very real. If you ever get to that point where you just feel like you are about to snap, put the baby down, walk away. Call somebody. You need to go get help. And then you need to think about that severely. You really need therapy. But think about it, okay? Because if you've experienced it that time and you get pregnant again, more likely you may experience it, and it may be worse. So I'm not trying to still, deter you from having a cesarean, but there are things that come along with that. That can happen with the vaginal delivery, a natural delivery. It's just a multiple thing. I'm speaking on having multiple children, large families. It's a mindset, okay? I see a lot of people having stair-step kids. I had a couple of stair-steps. I didn't have any help. But again, we weren't trying to do this and that and go over here and go over there and make sure the house was perfect and all the meals were, this, that, and the other. It got done. I didn't put any pressure on myself, and I still don't put any pressure on myself. And I get a lot of people come and say, I don't understand how you do this. I don't see how you, this, that, and the other. Things are okay. And if they see things chaotic, if you looked at the laundry video, I still have a laundry issue right now. And I just tell them, I have 4 little bitty kids. Do you have 4 little bitty kids? Before you say anything, do you understand what 4 little bitty kids can do in 5 minutes? Okay? In 5 minutes. Now, would you rather me make sure the whole house is picked up and tidy and perfect? Or would you rather everybody be happy, clean, and fed? Okay? No, the house is not going to be dirty. It may be a little bit of mess. I get to the mess later, and mess is what I call piles of laundry or toys or mail or what have you. But the dirty stuff is done. But if you have that many little bitty kids, you cannot possibly worry about, I have to please this person and please that person and please that person and do this and that and that. And I was just on Facebook posting about that. That's not how I operate. Anywho, I'm on a rant. But, yeah, you have to be in that mindset to take care of that many children. And so if you have to enlist help, you have to enlist help. If your kids go to school, you have to factor that in. Mine are homeschooled, and simply if they were in school, my kids would be late to school every day, because just getting up to get them ready is a major job. Kudos to those who do it. I have done it in the past, and it was crazy. But those are things, you have to add in when you have large families. Having a large, or having, children and then having to go in for a cesarean, you need to think about, do I have the help to, family to take care of the kids, during the procedure, during the recovery, is somebody able to bring some meals over or send some delivery or something like that. I've been there, done that, all with no help. So it's up to you personally. I'm a strong person, and so that's how I'm able to do it. Not saying that because you're not strong, you can't do it, but it can be done. You just have to have that mindset. So, physically, mentally prepare yourself for what is about to happen, because having a cesarean, I say it's a piece of cake, but it's still major surgery. It's something that you're like, oh my gosh, my body's about to get cut open, and yeah. a lot of people take it, differently than most women, but pretty much all in all that you need to find a support system is what I'm saying, so you don't go through those periods of depression and psychosis and what else. I think the whole intimacy issue is something that a lot of women experience, and I think that's just in general, whether you have a C-section or not, and it's a mind thing. Get up and fix yourself up. Make yourself presentable. Do something that makes you feel like you again. Okay? You have your new body back. Get yourself back together. Don't go run a marathon because you just had a baby. Give yourself a year to get yourself, back to where you were. Usually in about 10 months, women are saying, they're feeling better about themselves. Their self-esteem is back. Your hormone levels are gone back to normal. Your shedding is probably, wrapping up or maybe just starting because you're going to have postpartum shedding. Things like that. But make yourself feel good. If you want to wear your pajamas all day, so be it. But sometimes get up, put some clothes on. I still stay in my pajamas. It's just whatever makes me comfortable. But don't sit there and just be in a dump, in a rut. And, I'm just so, I'm hurt, I'm in pain, fix yourself up. If you feel like after when you go back to the doctor, write down things, keep a little journal. If you're having headaches, if you're having backaches, if you're having trouble nursing, they're going to ask you about birth control. Don't let them force it on you. Just tell them no. Even the low estrogen birth control pill, that can affect your milk. Okay? It will dry you up. They will say, oh, you need this, you need that, you need that. And then you're going to have problems breastfeeding, and it's just going to be a mess. So don't let them, there are natural methods and other methods of birth control, but don't let them force it on you. What else can I say? In general, your C-section should be, whether it's emergency or not, your doctor should be able to explain to you, pretty easily, what's going on, and they should be supportive of you. I want to say VBACs. I know a lot of women are, they want to have the VBAC, and I said that if I had to go through labor, only to come to find out, I would have to have a cesarean. That would be exhausting. I would be disappointed because I did all that work for nothing, and I could have just, had the little C-section been done. VBACs are expensive, and a lot of times insurance will not cover them these days. That's why the doctor will straight away go for C-section. And a lot of people say, oh, well, it wasn't necessary. It wasn't this and that. You may think it wasn't necessary, but there are factors that determine, there are a lot of factors that determine whether or not you actually need a C-section. Doctors don't like to do C-sections. They really don't. So, you need to, not have that mindset, oh, well, the doctor's just making me do this, and, I could have done that. You could have a clotting disorder, or something like that. There's a lot of little reasons that a woman would have to have a C-section. It's, medically necessary. Yes, sometimes women are given C-sections for, no reason. And it used to be, it was elective. You could go in and ask for them. They don't do it like that anymore. They stopped doing that. You don't get to pick and choose. Hey, I want to do this and I'd rather do that. But all in all, if I had the choice, I would still choose a C-section. I think maybe I would like to know what it's like to have a vaginal birth, but I'm not upset because I haven't had one. I'm fine with the outcome because I've, prepared myself mentally. I've educated myself enough so that I know when I go through the procedures, I won't have any recourse. I don't have to say, okay, well, I did all of this and then look what happened. So I say, when a woman is pregnant, do not have that expectation that you draw up this great birth plan for this natural birth or this vaginal birth and, no way, when the doctor says C-section, oh, no, please, I don't want that. That's that negative behavior. Don't have that mindset. You need to focus on the baby and what is to come. However that baby comes, be grateful. You want a healthy baby. You want a healthy yourself. You want yourself healthy. Those types of things, when you worry like that, will elevate your blood pressure. That in itself is a whole nother issue. You don't want to be in the hospital 8 or 9 days. I love it because it's a vacation from the kids, but after a while you want to go home. But when you are, thinking like that, you end up staying, you just end up staying, and it just becomes, oh my goodness, can I just get out of here? And then you end up sometimes having to be on medication for, a duration, probably that first 6 weeks or so until you go back and the doctor checks you and says everything's okay. Driving, you pretty much know you can drive. Okay, the first time I drove after a week. The second time, I don't know, it was probably 3 days. The last time I drove home from the hospital, okay, they're not going to let you do it. Okay? The way I'm going to tell you the way you do it. I don't see really why anyone would have to, but there are women that have done it. You just have to get somebody to take you to your car if you had to drive to the hospital yourself. They would have to take you to the car from the hospital door, and then you drive home. Of course, you're going to be on medication, so you need to consider that. Please do not get in the car and drive. Okay? Don't do that. But yeah, I did drive home, and I had to keep driving because things had to keep moving. So I didn't do anything major besides laundry. But let's see. Yeah, you want to pretty much just take it easy once you get home. Have a meal plan, have things frozen. Make it as easy as possible so you don't have to get up and move around too much, especially during that first week. If you have other kids at home, have and get the neighbor to help. If the neighbor has a teenager or something like that, or you have a cousin, or just anybody that you can to come and help at times to occupy the kids. Have activities for them so that they can go and get and do without you having to do too much. But usually by the time you go home, you're able to get up and move. I don't like to stay in the bed. So I would say day 5, you're ready to get up and you want to just kind of take a little walk around the house, up and down the stairs and whatnot. But don't overdo it. Again, don't go try to clean up the whole house and this is a mess and I can't believe, this, that, and the other. In the grocery store, don't go to the grocery store. It's too much. So, what else? Candidates. Yeah, take care of yourself, exercise, eat right, ask about those incisions. Make sure you get that medical history. Ask this, like I said, ask as many questions as you can during that procedure. That way you're able to tell any future doctors that you may have what actually happened, because what you say is what they have to go on. Okay? They won't really know anything until they go in. And at that point, it's pretty much kind of too late, because the doctor may tell you, okay, you can have a vaginal birth, when in fact, like me, the doctor had already said you are not going to be able to vaginally deliver a baby. I think somebody commented, does height have play a role? I really think it does. I think it does. If you are short stature, a lot of short stature women tend to have a smaller pelvis. And so that does play a factor in having cesareans. I think my mother-in-law was she was 4'11", she had 3 kids, but she also had a 10-pound baby. So, but they were cesareans. So I think, that one was, that first one. I think it does. But just because you are short, it does not mean. But it's likely that at least one of my girls will have a cesarean, because I have had a cesarean. My mother had only 2 kids, but she did not. She had both of us vaginally, and she is 5'6". So I think so. I know my niece just had one. Her mother had cesareans, and we're both 5 feet. So yeah, you want to think about that. Your bones are smaller. Your body's a little more compact than everybody else's. So even the smallest baby, my smallest baby was 3 pounds and 7 ounces. One of the twins. So yeah, I had a cesarean with him. Anywho, I will check for comments, and I will come back and maybe later on today and start the cesarean stories, and yeah, try to make them really brief. Thank you guys for hanging in. I know these videos are kind of long, but I just like to give a comprehensive view, because there are a lot of people that don't know, and if somebody had done this and I was able to see this beforehand, I would have been ever so grateful, because I would have known what to expect. Because there are a lot of things I just, think, okay, well, I saw this and I know this and they're telling me this, but again, it's a doctor, and it may be a male, and the doctor, he's never had a cesarean, so he can't tell you. So, yeah. Thank you guys for hanging in there. Share, like, thumbs up, subscribe. I'll be back. Bye.